Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be talking about Allen's hand test for vascularity, sometimes it's called Allen's test or Allen's hand test. This is a test that looks at the capillary refill time in the hand for the radial and ulnar arteries. Now, it's not a special test that's commonly used in a physical therapy clinic, but there is some utility to it, and therefore it behooves one to know how to perform it and interpret it. So let's take a look at that. So, to perform Allen's hand test, the patient's going to be positioned in sitting. Their forearm is going to be positioned resting on a table like this with the test side palm facing up. Now, the PT is going to compress both the radial and ulnar arteries of the patient's wrist. If you've got pretty decent sized thumbs, you can probably get by with compressing those arteries just with your thumb. But if you've got smaller fingers, you might want to consider using a couple fingers or maybe even 3 to perform that compression, okay? And then we're going to hold that compression for 10 seconds. We'll see what that looks like. So with this thumb over here, I'm compressing her radial artery, that's on the thumb side. And then with this thumb over here, I'm compressing her ulnar artery, which remember is on the pinky side. And we're gonna hold that compression for at least 10 seconds, okay? After that 10 seconds is up, the patient is instructed to close and open their fist 10 times. Now, as I'm performing this compression, and then also as she's closing and opening her fist right here, you may notice that the palm loses its coloration. It becomes paler, and that makes sense. We're compressing those arteries, so we're losing arterial blood flow to the hand, okay? So the palm should become paler, all right? And it does take a little bit of time, so it's very subtle. It's more noticeable when we release the compression on one of the arteries. We'll see that in a minute. And here she's closing and opening her fist 10 times, okay? Now, you should be able to see here that the palm is noticeably paler. It's lost a lot of that pinkish red coloration. That's because we're cutting off the blood supply. Now at this point, I'm going to release the compression on one of those arteries. Whatever artery I release the compression on, that's the artery we're looking at the capillary refill time for. So if I release this thumb right here on the ulnar artery, we're looking at capillary refill time for the ulnar artery. If I release this thumb and I release the compression on the radial artery, then we're looking at capillary refill time for the radial artery, okay? And once we release that artery, we're looking for the time it takes for that coloration to return to the palm. That is the capillary refill time, okay? So which one do I release? I honestly forgot. So I release the ulnar artery. And you notice, very subtly, the hand or the palm gets its color back, okay? And you kind of make an estimate of how long it takes for that coloration to come back. And then the test is repeated exactly the same way as before, except this time I'm going to be releasing my compression on the radial artery. So I'm compressing both of them for 10 seconds. And then after those 10 seconds, she's going to close and open her fist 10 times, okay? Again, you can gradually see there the palm is losing its coloration. And then after those 10 fist movements, I'm going to release the compression on the radial artery. There it is. And you can see there the color returns pretty quick. I would actually make an argument for her that she has a better capillary refill time on the radial artery, and most people do. Okay? And normally this test is performed for the sake of the radial artery. We'll get there in just a minute. So what is a positive Allen's hand test? Well, for either artery, when the return of palm coloration, that is the capillary refill time, takes it longer than 6 seconds, that is considered a positive test, and there's some degree of impaired blood flow. So why would you perform this test? Well, there's a couple conditions that you might be suspicious of. One is called thromboangiitis obliterans, more commonly known as Berger disease. Now, in Berger disease, there is chronically impaired blood flow to the hands and the fingers. And really, I should say the digits, because this can occur in both the hands and the feet. And this particular patient I had was displaying signs of impaired blood flow. And it turned out that her father had a history of Berger's disease. He actually ended up having to have multiple digits amputated. And then, long story short, it turned out this particular patient also had Berger disease. Another condition you might see is thoracic outlet syndrome. There's a bunch of signs and symptoms consistent with that and other special tests. We cover those in other videos. But at some point, you might need to differentiate between the various subtypes of TOS, and those would be neural, arterial, and venous TOS. Now, if somebody were to have arterial TOS, presumably there's some issue up here at the scalene triangle, that interscalene space. If there's scalene hypertrophy or some other issue that's compressing the subclavian artery, well, the subclavian artery ultimately gives pretty much all the blood flow to the upper extremity. So if you're knocking out a little bit of the subclavian artery, you're going to have some impaired blood flow to the hand. And it's possible that Allen's hand test will be positive in the case of somebody with arterial thoracic outlet syndrome. And that can be one piece of evidence that they actually have that condition. You can also see here that this test is also useful when you're determining whether or not somebody's a good candidate for radial artery harvesting. Why might you want to do that? Well, if somebody needs a forearm flap elevation or coronary artery bypass grafting, oftentimes for the coronary artery bypass graft, they'll actually harvest some from the radial artery on one side. Okay, so hopefully this video gave you a good understanding of the utility of and how to perform and interpret Allen's hand test for vascularity. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.